Hello, welcome to the News Minute. I'm Anjana Meenakshi, and today we shall be discussing the Andhra Pradesh Health Department allowing Ayurveda doctors to perform surgeries. Now, at the outset, I should clarify that this is not a move that the Andhra government has come up by itself. It's been set in stone 5 years ago when, under the 2020 Indian Medicine Central Council PG Ayurveda Education regulations, the union government, the BJP union government, allowed this to happen. It just so happens that the Andhra government is clearly implementing this now, which means going forward, Ayurvedic doctors can very properly, or to use the term properly would not be accurate, but can perform surgery. To discuss this and more, we have with us former Principal Secretary for the Department of Health and Family Planning, Mr. P.V. Ramesh. Sir, thank you for joining us.
Good morning, madam. Good morning. Thanks for inviting me to be part of this conversation. Thank you.
The pleasure is ours. So, Mr. Ramesh, I'd like to start off before we get into Andhra. I'd like to ask you in 2020, the union government passed the Indian Medicine Central Council amendment regulations, right? And which basically allowed Ayurveda doctors, and not all Ayurveda doctors, just Ayurveda doctors who have an MS in either Shalya Tantra or Shalakya Tantra, which are branches of Ayurveda, to perform surgery. Right now, since 2020, the Indian Medical Association and many health experts, activists have been opposing the move. Where do you think this opposition comes from? What's the catch?
Thank you so much for having me. I think the major important issue, I think, in the narrative needs to be reframed. The issue is this country, we as Indians, the government, providing quality, affordable, accessible healthcare to every citizen of this country. Is this considered a public good? Do we have policies, programs, systems, and structures in place that ensures that every citizen, whether he or she can afford or not, wherever she lives, can she access quality healthcare? This issue actually has not been discussed and debated seriously, though there have been many, many talks, many, many people writing. So the governments have been very ad hoc and cavalier in its approach to providing healthcare. Since there's a deep decline in the quality of healthcare provided by the public health system, the government launched sometime in 2005 the National Rural Health Mission, which has since become the National Health Mission and subsequently become the PMJ. Now, this has taken a very different form, and we have. So this is on one side. This is lack of strong policy, political commitment to provide universal quality healthcare to citizens, and the second is further complicated by the fact that we have our own traditional system, Ayurveda,
Right.
Siddha, Unani,
None.
and
Yeah.
homeopathy. The rubric of Ayush really has these four different strands. And then the allopathic medicine, which is sort of universal now, which has evolved over a period of time. Now, the major problem has been that these two has evolved very, very differently because each of these systems, the Ayurveda, which had come from the traditional Indian learnings, which essentially based on certain fluids in the body, how they interact with the cosmic system, and the use of the natural leaves and other herbs to treat these medicines, these ailments. So that is where the problem really comes. There's been real effort to understand how these systems, these indigenous systems, these traditional systems really work. And application of the modern scientific methods of inquiry to conduct further research and then carry this forward has not happened. Instead, what the governments have been doing is number one, independently promote Ayush because it's traditional, it's sort of a nationalistic. The second is to adopt some of those ideas and ideals and principles from the allopathic medicine and then incorporate into the Ayush system. So that is
Right.
where we come to surgery. though it's been said, I mean, it's been reported, Sushruta was the first great surgeon. Actually, it is said that way back 2,200, 300 years back, he had done plastic surgery using ant intestines to replace a nose that had been lost in a war.
Right.
And so, I mean,
Yeah.
these we do not know how much of it is mythology and how much of it is hard evidence-based uh, documentation. But nevertheless, the belief persists. And there's also people who say the first great head transplant was that of Lord Ganesha. So,
Yeah.
so we are really trying to implant these ideas into the system that exists today in 2025. And I'm sure the National Indian Medical Council's um the the recommendation or its resolution, which
Regulations.
the
Yeah.
Ayush Ministry seems to have accepted, that the Shalya Shastra and Shakalya Shastra can perform these 58 different surgeries. Now, it raises a number of questions. The questions being, uh, what about anesthesia? Who provides the anesthesia? What is the level of training that the Ayush doctors receive in terms of their own surgical skill sets, their understanding of the anatomy, physiology, the pathology, and what's the diagnosis that leads to surgical intervention? Because the traditional Ayurveda or homeopathy or Siddha or Unani do not have a strong surgical component to it.
So, coming to exactly that, right? Because we are looking in practice what this means. So, there are 58 surgeries in total, 39 under Shalya Tantra, which we commonly know as general surgeries, and 19 under Shalakya Tantra, which is disease of eye, ear, nose, throat, head, or orodentistry. Right? So, we can't look at all 59, obviously, but let's look at three of them. So, one is bowel resection, which is cutting out a damaged or diseased part of the intestine. The other is cholecystectomy, the surgical removal of the gallbladder, or a glaucoma surgery, an eye operation. So let's look at these three. And my question here is twofold, sir. One, what kind of training do MBBS doctors have to undergo to do these three procedures in particular? And two, are Ayurveda doctors equipped to do these kind of surgery? The government believes they are. What do you think?
The allopathic doctors study MBBS for 5 years, do an internship for a year, and then do masters in general surgery for 3 years. If you're a general surgeon, then you really are operating on cholecystectomy or intestinal resection. You are an ophthalmologist, then you operate on the eye. So it's a 3 years of intensive training on these procedures that the specialists. So the basic surgeon, the MBBS doctors are not expected to perform any of these procedures unless it's an emergency. They are not fully equipped or trained to perform an intestinal resection or a cholecystectomy. So this is one important aspect. Now, second is the specialist general surgeon. They operate nowadays. There's a pinhole keyhole surgery. You don't really open up the abdomen. You have very sophisticated equipment which enables you to reach the gallbladder and resect it. So there is a very sophisticated uh, techniques, which number one, first and foremost, for diagnosing why there is need for a surgical intervention. Number two, anesthesia that is safe, that ensures that you not only are put to rest during that particular period, your vitals are monitored, and then after surgery, you recover, and then there is a post operative treatment. There's a treatment to prevent infection, which is potentially possible. So, this has evolved over a period of almost 150 years. I mean, if you trace back history to about 200 years of surgery, and when first ether was introduced as anesthesia, and then over a period of time, a number of transformative changes have taken place to reach where we are. Similarly, an ophthalmic surgeon. So this is a team that operates. It's a surgeon assisted by assistants, nurses, anesthesiologists, and then there is a post-operative recovery and treatment. Now, for Ayush doctors who go through their learning, uh, having been a vice chancellor of Health University, I have some understanding, and apart from being principal health secretary, I have some understanding of the education that they receive. In my days, which was about 15 years ago when I was principal secretary, uh, we didn't have the specializations which we are talking about today, the 2020 notification that the Ayush doctors would be undertaking surgery didn't exist in that time. It was expected that the Ayush doctors essentially would be functioning as physicians in those people who they believe, there are a number of Indians who rightly believe that Ayurveda or Siddha or Unani or homeopathy is very effective, especially for chronic diseases and diseases to which allopathy may not have an immediate answer. So I'm not sure to what extent uh, the these Shalya Shastra experts are prepared to undertake this sophisticated surgeries. But nevertheless, let me raise few important issues which are relevant. Number one, who gives anesthesia? Is this anesthesia with the modern anesthesia, the allopathic doctor who gives the anesthesia, or if you adopt the old method of hitting a person with a hard rock or a or a stone so that he becomes unconscious and then you operate? What is the real? How do you really ensure that it's a safe surgery?
Right.
Number two is what is the instruments that are used, and number three is what is the post-recovery pathways, post-surgical recovery pathways? What is the protection from potential infections, recovery, rehabilitation? These aspects, how are they covered? It's not clearly known. But more importantly, let me raise a few more issues. Is number one is why are we doing this? I mean, where is the need to authorize uh, tomorrow? I mean, if we start with Shalya Shastra experts to perform general surgery and sophisticated surgery like cholecystectomy, tomorrow you may authorize an RMP to also to perform similar surgeries. I'm not sure why this is required. Number two is, are we able to fully utilize the services of the specialists that we already have? The general surgeons, the anesthetists in Andhra Pradesh, are we able to fully utilize? What is the urgent need to introduce uh, this new stream of surgeons whose training is suspect, to say the least, and their skill set and their competence is not validated.
Okay. So one thing I was keen on is looking at glaucoma. Andhra, for instance, has high instances of glaucoma. And when I spoke to you for a text interview I did with you for the News Minute, you also said that among the five South Indian states, Andhra performs the worst when it comes to health indicators. So let's talk about that a little bit. How does this move of allowing Ayurvedic doctors to perform surgery affect Andhra's health system? Because there is no dearth of doctors already.
Yeah, I mean, Andhra is one state. I mean, like other South Indian states, the five South Indian states has more than a lack of doctors, allopathic doctors. I'm not even counting the Ayush doctors. The allopathic doctors on the registered, yeah, on the Andhra Pradesh Medical Council. I mean, that works out to be almost one doctor for every 550 population. So almost about every 500 have one doctor. The general international norm for uh, the WHO recommendation is 2.8 health functionaries for 1,000 people. This includes ASHA worker, ANM, the public health nurse, everybody together. So we have Andhra has surplus doctors. India has a problem, but Andhra or the South Indian states do not have problem of manpower supply, particularly of doctors. In addition, we are producing, Andhra Pradesh produces about 6,500 MBBS graduates and about 3,000 and odd specialists in different disciplines. Now, the problem really is twofold. One problem is their deployment. How are these doctors? Where are they positioned? Where are they placed? So you have surplus in certain parts and you have a shortage in certain parts. Number two is we don't have a referral system. A primary health center essentially catering to preventive, promotive, and the first level healthcare, referring them to secondary and thereafter to tertiary. So we have a poor management of the health system. And this is further complicated by an explosive growth of the tertiary private hospitals. Tertiary private hospitals that are unregulated, that do not have a quality parameters that are defined, the clinical pathways that do not exist, the pricing that is totally obtuse and opaque. So, consequently, what happens is that, and also ethically challenged in many cases. So, you have a problem on multiple counts. So, the problem is really a, a very clear health systems based policy, programs, and the managerial capacity as to how do you harmonize the private sector healthcare provisions as well as the public healthcare system, and how do you ensure there is a proper, strong, robust primary health system and a gatekeeping that ensures a streamlined referral. This does not exist. In addition to it, it is complicated by the fact the medicine's quality is suspect, the regulatory mechanism is weaker. So consequently, what the governments are doing is they've been tinkering with the system and further weakening it in the process.
So, if I'm understanding you correctly, with more Ayurvedic doctors being deployed, one way to argue is listen, there are doctors. It's not to say that certain areas lack doctors. And that is an argument the state government, any state government can always make. But the quality of medicine is again under suspicion. Is that fair to say?
It is fair to say, notwithstanding the fact that we export 40% of the nation's, I mean, between Telangana and Andhra is the pharma's hub of India, and we are the major suppliers globally. Yet, I mean, I'm not here talking about the large multinational listed pharma companies, but there are a number of smaller ones, and because of our procurement system is so imperfect, so opaque, so ridden with corruption. So ultimately, what gets delivered in terms of quality of medicines is also not always the best.
Just to circle back to Ayurveda itself, because that is what this move is about, sir. Now, just to play devil's advocate, you spoke about drugs, medicine being expensive. There is always this talk, we've been talking for a long time about how there's a medical mafia which overcharges patients, doesn't care about health, the health crisis at large, right? We see botched surgeries in allopathy quite regularly. Death by negligence is one of the most commonly put clauses in FIRs across police stations in this country. Why is Ayurvedic doctors and them being allowed to perform surgery specifically much more a bigger problem? Because if it's about negligence or if it's about health hazards, very easily proponents of Ayurveda could turn around and say, what makes you think allopathy is perfect? It's not. People die there as well. So why are you, you know, pinning the blame on us exclusively?
No, there's absolutely no doubt that things go wrong anywhere. I mean, in the hospitals. I mean, and that's why the Hippocratic Oath. I mean, the first thing that the doctors take is do no harm. You may not, you may not alleviate suffering, which of course is the, a doctor is supposed to be a healer. That is the first objective of being a doctor. Doctoring is not merely giving a medication. It's really, you're supposed to heal a person. Is he heal not just the body but also the mind and the soul? So it's supposed to be a very comprehensive approach. So things do go wrong sometimes by accident, by deliberate. This is universal. Now, one of the important things that I have learned, and what the medicine has learned, it's the constant quest to be better. is what has led to allopathy or the practice of modern medicine to where we are today. How do you overcome these shortcomings, these mistakes? What do you learn from them? And how do you avoid them? And how do you improve your skills? I mean, one of the problems which you point out, let me also go back to this. The other day, I was talking to a few professors who had worked in the government medical system. They were professors of surgery who now work in private hospitals, and this is in Andhra Pradesh. I just been there, and what they tell me is a scary story. And let me also say this very clearly: is they say they used to do about 4 to 5 surgeries every day in their hospitals while they were working in the government system. This is on an average, sometimes even 10, and many of them emergencies. And they have uh, five uh, MS, those who are doing MS general surgery, what they call residents. If you have 5 MS general surgery and they are distributed, so each unit has about 3 to 4 surgeons, I mean, trainee doctors, trainee surgeons. Now, the trainee residents get to operate on at least 1 to 2 cases every day. Now, the surgery cannot be learned from YouTube videos. It cannot be learned from simulations. It cannot be learned by mannequins. It has to be learned. It is a hard learning process. I had done MS general surgery myself, though I didn't complete it. So I'm not a qualified surgeon, but I had done a year plus of surgery before I joined the IAS. So I know how hard we used to work, and it used to be a 24/7 grind. And you learn a lot from your seniors. So it is actually, surgery is a very traditional art and science. You have science, and then it's an art, and it's a very guru sishya tradition. You learn from your masters, your teachers, your professors. Now this is what is expected to happen. Now what's happening in the private medical colleges, my friends tell me, is that in a month they get to do 1 to 2 surgeries. Here you are talking about, in a government hospital, you're doing 5 to 10 surgeries a day. You're doing 1 to 2 surgeries in a month in a unit, because no patient is coming to a private medical college for a surgical procedure. At least there are two private medical colleges, which I won't refer to their names, where these gentlemen are working. Now they tell me they have 10 surgical residents each year, because they have sort of exponentially increased. So 3 years means 30, and 4 units, these 30 are distributed. There are 7 in every unit. 7 of them get to do assisted surgery. Forget about doing it. Assisted surgery once in 6 months.
I see.
Now, when they graduate, what type of a surgeon emerges? And virtually they say the pass out rate, the qualification, those who get to be awarded the MS degree, is 100% in the private colleges, because you're not supposed to fail. So you are producing, and these gentlemen who are doing MS general surgery have paid 3 to 10 crores to get a seat in MS general surgery. You pay 3 to 10 crores to become an MS general surgery student. You get trained. You get to do one surgery in a week. Then you go to your father's or your father-in-law's corporate hospital. Start doing surgeries there. What is your skill? What is your skill? And what is your competence to undertake surgery? That's why people die. That's why there are infections. That's why there are complications. Now, if this is the system in allopathic surgery, I cannot imagine what it is with Shalya Shastra. Who will teach them? Who will train them? What is the basis for intestinal resection or cholecystectomy?
You said yesterday when we spoke that the concern you have is that the poor will become guinea pigs if this is allowed. So, could you please elaborate on that?
That is the biggest concern I have. Because what would happen is, in the government, I mean, I spent 36 years in the government, so I know a little bit. Now, what the normal default mode in the government is, you make a policy to please somebody. Number two, what you do, I mean, it's quite possible that this policy is introduced to help the private Ayush medical colleges get a PG seats approved so that they can collect money to give seats to Shalashastra training. So that's where the pathology starts. So who will train them? Who will administer anesthesia? What is the basis for diagnosis? And what is the intervention? How is it different from the allopathic surgical specialists? And is a procedural difference? Has it been standardized? What is the quality of care? Now, what the government is likely to do? So, people like you and I are unlikely to choose this option. I'm not likely to go to a Shalya Sastri. Instead, what I would do, I would go to the best of the corporate hospitals where either I pay or the government pays for me. Now, what the government would mandate is under Arogyashri, under PMJ, that anybody who has a cholecystitis would undergo surgery by a Shalya Shastri. So, Dr. Shastri would now start operating on the poor people, and they would be left to the God they believe in for their recovery. So, this is likely to be used on the poor, unsuspecting people rather than those who exercise conscious choice. I mean, I'm sure there would be strong proponents of Shalya Shastra in the citizens of the 6 crore Andhras and 146 Indians. I'm sure there would be hundreds of them who would like to be subjected themselves to surgery or their relatives to surgery. But that number would be very, very, very small. This would be a policy proposition. In order for government would have to prove tomorrow that Shalya Shastris are as good as MS general surgeons or ophthalmic surgeons. So consequently, it would be the poor people who cannot afford private sector healthcare, who cannot get ailments, they would be driven to these hospitals, these Ayush surgical hospitals, to undergo surgery, and they would be, without any second thoughts, would be guinea pigs.
All right. Okay. Lastly, Mr. Ramesh, and this is probably my only political question, so to speak, but Chandrababu Naidu or the TDP, the party which is ruling the Andhra state government right now, both Mr. Naidu and the TDP have always been science over faith kind of man or a science over faith kind of party. That's how the party's ideology has functioned. That science and technology are going to be privileged over faith, over traditional ecosystems. That's how it's always worked. And in more cases than not, it has worked in Andhra's favor. In some cases, it hasn't. But no government in good faith would want to endanger the health of its citizens. So, this is a very unlikely move for the TDP to have made. Since you worked with the government and since you are familiar with the Telugu politics ecosystem, could you tell me why this is happening? Why is this something that the TDP has allowed to happen?
So I think, I will answer it in two strands. Number one is TDP is part of NDA. It's an NDA government in Andhra Pradesh, not a TDP government.
It's
And the
TDP
health
led
minister
government, yeah.
is, yeah, it's a TDP-led NDA government in Andhra Pradesh, and the health minister happens to be a BJP uh, MLA. And that is besides the point. There is also a certain eagerness, and this is not limited to TDP or BJP. There's a certain eagerness and over enthusiasm on the part of the Telugu regional parties to please the central government. And this is true of all the political parties. And let me also say this, and this I say this with a broad brush, and this applies to all the political parties, including the Congress and the BJP. They have not had a very clear, pronounced policy or program for delivering universal quality healthcare, and especially to strengthen the health systems, to have a streamlined referral system, to have a robust primary health system. Yes, certainly NRHM and NHM have contributed to strengthening of the maternal and child health services. Now, I mean, India is such a diverse country. I mean, to compare Uttar Pradesh with Kerala would be such an apology in terms of understanding either policy or the health system. So, my own take on this is, of course, each state requires a customized uh, strategy, policy, and program to address the health system. But the broad parameters and components are very well known. The major problem being that the political parties have not seen healthcare as a priority for people. You know, in any other Western country, the health happens to be the number one or number two on the political agenda for elections. Whereas in India, it finds its place somewhere in a corner at the end, and even that has arisen only in the last 10, 15 years. It didn't exist before. So I think the first important issue for all political parties really is number one, do no harm in your policies. You know, as the old Hippocratic oath says, please don't harm, don't tinker with health systems. You see, in their enthusiasm to do something, I see, particularly in Andhra Pradesh, there seems to be an enthusiasm to do something. Now, we can't do much in the other areas, so let us tinker with what exists. My humble request is please don't tinker with the system. If you can, there are very, very established models in Europe, in NHS, in Kerala, in Tamil Nadu. They've done an outstanding work. I mean, you don't need to go far abroad searching for this. You go to China and see how they have synthesized the indigenous system. That's also a old civilization. The Chinese have synthesized, integrated the indigenous system with with the modern system. They don't allow their indigenous doctors to perform surgeries. They provide primary health care. They are active in the chronic disease management. They have invested billions of dollars in research in their traditional medicine to apply the modern principles of scientific inquiry. And they have published a massive number of papers in the international journals and took what is best in the traditional medicine. What is the investment we have made in studying, understanding the wisdom that lies in what Susruta had done and said, and what Dhanvantari has done and said, and what Ayurveda has been doing. So, this is where we need to invest. We need to invest, we need to understand the modern scientific principles that are universal to all disciplines of science. And when RTCs are random controlled trials are being applied to the practice of economics, why can't they be applied to Ayurveda or homeopathy? So I think the issue really is that there has to be a much, much deeper understanding, appreciation. There has to be an investment in research, and the effort must be not this sort of a tinkering and doing a lot more harm than good to the society and to the people. So what we need to really do uh, is to is to work towards a consistent policy. I mean, Kerala has not transformed itself in a day. Neither did Tamil Nadu. Tamil Nadu has happened before our eyes in the last 30 years. They have transformed. They have been able to vastly improve their healthcare system.
Hmm. All right, I understand. Here's hoping politicians consider taking the Hippocratic Oath. I doubt it. But thank you so much for joining us, sir. And
Thank you.
this interview was extremely important because we had to look at the health crisis in Andhra and the health ministry's announcement allowing Ayurvedic doctors to perform surgery. We will continue following the story. And if you believe this is the kind of information you need to ensure that the vibrancy of a democracy continues to thrive, please subscribe to the News Minute and pay to keep news straight. Thank you so much for watching us.
Thank you and all the best. And I endorse what you said. Thank you.
Thank you, sir.